Welcome to the Gross 1 Upper Extremity Palpation video. Lab 2, Superficial Back and Scapular Area, Posterior Arm. We will begin with the trapezius muscle. You will need to outline the trapezius muscle, starting at the external occipital protuberance, working your way down to the acromion process of the scapula, and then angle down to the middle aspect of the lower back. You will also have to test this muscle. You will put your hands on the patient's shoulder and have them elevate or shrug their shoulders against resistance. Next, the rhomboids. They are found between the vertebral border of the scapula and the vertebral column. To find the vertebral border of the scapula, have the patient bend their arm behind their back. Work your way toward the midline from the vertebral border of the scapula. You will also have to test this muscle against resistance. You will have the patient adduct their arm against resistance. Next is the latissimus dorsi. Here you will palpate at the posterior aspect of the lower back. You are also going to need to test this muscle against resistance. You will start with the arm abducted, and you will want the patient to adduct the arm toward their body against resistance. You should feel that muscle contract. There is another test for this muscle. Put your arm on the hand on the latissimus dorsi and have the patient cough. You will be able to choose which test during your palpation practical. Next, teres major. Here you palpate this muscle at the posterior aspect of the axilla. Start with an abducted arm, and you will ask the patient to adduct their arm against resistance, and you should feel that muscle tense. Next, serratus anterior. This muscle is too deep to palpate. You will be testing only. Have the patient push against something solid like the wall and look for any winging of the scapula. Here, nice flat scapulae. No winging, serratus anterior is functional. Next muscle, deltoid. We are not palpating the different heads. We are only palpating right in the middle of the arm. You are to palpate and test. With your palpation, with your arm, with your hand on the patient's arm, you are going to ask the patient to abduct their arm against resistance. Next, supraspinatus muscle. You are going to be palpating above the spine, but also have the patient extend their arm back slightly. That will make the muscle stand out. You will then have the patient carry out abduction against resistance for the muscle test. Next, triangle of auscultation. Now you will have the patient bend the arm behind the back, locate the inferior angle of the scapula, come medial, drop down. You are now in the triangle of auscultation. Next, triceps brachii. This muscle is located on the posterior aspect of the arm. For testing, have the patient extend their forearm at the elbow against resistance. You should feel the muscle tense. We are not distinguishing between the three heads of the triceps brachii. This is the end of Lab 2.